they are one of the most thoroughly researched ingredients in the world, and their use is really tightly regulated and rigorously tested by the European Food Safety Authority. But there is so much confusion and kind of mixed opinions amongst health professionals and the nutrition community about the role of sweeteners, how they affect our weight, whether they affect the gut microbiota, and whether or not they are safe. It was quite interesting. We had a recent survey a couple of years ago, and 41% of health professionals don't recommend them because they just don't know enough about them, and they're not confident in the advice that they're actually giving. Whereas 76% of people say, yeah, their health professionals do recommend them to the patients for diabetes management, weight management, or sugar substitution. And they believe they have a place in a healthy diet, allowing their patients to enjoy those kind of sweet tasting foods and drinks without those added free sugars, which we should all be cutting down on. And I think really the misunderstandings and the kind of controversy around low calorie sweeteners is really partly explained by the kind of inconsistent and sometimes really contradictory information that's presented by individual scientists like Professor Millstone, which will come on to campaign groups as well, like Action on Sugar, in relation to kind of their safety and how it plays a role in weight management. So there is much scaremongering claims out there and proposed adverse effects, often based without substance, poor, little or no evidence, or just selective use of evidence, and I think as health professionals, only 9% of health professionals have actually done any official training on sweeteners and their role in the diet. So there's certainly some work to be done. Yeah, absolutely. I mean, I definitely think as a dietitian, sweeteners do have a positive role to play. And certainly, as we've heard, meeting free sugar recommendations, we've come a long way, but we still need to go a little bit further. Average intakes for adults are nearly 50 grams of free sugars a day. They support weight loss and weight maintenance, which, as we know, 2/3 of adults are living with excess weight. And we know it's a risk factor not only for things like heart disease and cancer, but it also affects things like risk factors with COVID as well. So it's even more important to get people's weight down. Diabetes management and blood glucose control, and obviously tooth decay as well. There's lots of clear benefits to have sweeteners and for patients to use in their diets, but they need those kind of reassurances. And I think there's a real opportunity for education around sweeteners. And I think really that's where our nutrition community comes in, like myself as a dietitian. Media-facing dietitians like myself have a really important role to play in kind of counteracting that misinformation in the press, using that supported science, offering balanced evidence-based advice, and look at the whole totality of the evidence with regards to sweeteners, and really also convey the fact that the regulatory framework in Europe really acts as a safeguard for our public. There's a lot of work that's actually been done. Well, I think up to a point. I mean, I think again, there's some misunderstandings with regards to kind of that energy balance. Most people nowadays know that they should be cutting down on free sugars in their diet, and it's a good idea for the sake of their waistlines and their teeth. But many are struggling with the weight and want a kind of simple option to kind of reduce their calorie intake and sugar intake without actually making many changes to the diet. So that's why kind of sweeteners are often seen as a really favourable option. But I think it's equally important to remind clients and patients, calories in is equal to calories out, and sweeteners are not a silver bullet for losing weight. They allow people to enjoy kind of sweet tasting foods, and when they're used in place of sugars in many foods and drinks, they provide a really tasty low calorie option, of course, but they've also got to look at their overall calorie intake for the diet. And I think that's a really important message that needs to be conveyed kind of in all communications, that they're only as part of a healthy, balanced, calorie controlled diet. Well, most nutritional professionals like myself, we get lots of information from professional bodies, things like NICE and SIGN, which is the Healthcare Improvement for Scotland. And there's certainly lots of information out there. I mean, there's decades of research papers. There's some really good nutrition reviews done by the British Nutrition Foundation. And even things like our health professional magazines like NHD and Complete Nutrition has got some really good reviews on the role of sweeteners and safety and benefits. Another place to look is kind of the position statements on sweeteners, both produced by the British Dietetic Association and Diabetes UK. And then you have things like the International Sweeteners Association and the European soft drinks industry, which they have done some really great infographics and fact sheets. And of course, while we're all here, you know, last but by no means least, you know, the British Soft Drinks Association has now produced a kind of full toolkit, including kind of PDF resources, which we can use with our patients or just as a resource in our everyday working lives. Goodness, absolutely. I mean, how many times have I heard people saying, you know, the Daily Mail says, so, you know, it must be true. You know, headlines such as artificial sweeteners are toxic. Do the public know benefits in terms of understanding the benefits of sweeteners? And you think about it, you know, the public gets so much information from about diet and health and our well-being from the media. So the kind of the quality and the quantity of information in newspapers and magazines and on television and things like radio as well is really important to kind of shaping public knowledge and opinion about sweeteners. And certainly for me, it kind of worries me that there's so many journalists with no nutritional qualifications and they are churning stories out quicker than ever before, you know, sometimes kind of 5 features a day on some online newspapers. And they're often using kind of inaccurate or misleading information. And, you know, these nutrition stories are shaping people's opinion and lifestyle choices. So it's really important to get the content right. And certainly as a health professional who works with the media, I kind of want to see a more balanced media coverage, which improves people's knowledge and understanding of the role of sweeteners. And it is based on supporting science. I want that coverage that builds people's confidence in sweeteners and separates that kind of fact from fiction. You know, make sure that experts like ourselves who fully understand the quality of the research are commenting on these stories and helping to kind of shape the health of the nation.